I think what we do at Trillium to make our recovery process as smooth as possible is we'd like to inform the patient kind of straight away what's going to happen. So that's going to be the main thing. And we realize that swelling and discomfort are going to peak 2 to 3 days after we're done. So what we'll do is we'll provide pain medicine, we'll provide an anti-inflammatory, give a backup pain medicine in case that's not working. Then we use a steroid, both that is injected and then also as pills. So with all that anti-inflammation medications, we're able to lessen the amount of pain that people have. So inflammation, one of the components is pain. So if we can lessen inflammation, then we can lessen the pain that they have. And then also we have little ice wraps that go around patients' heads, and that will help them both with applying some pressure to their cheeks, but also giving them some ice, and then they can change that over to heat over the days that follow. So we try to have everything covered. And then the other things are kind of the intangible things are that we've been doing this a long time, and one of the things is if we can get in and do the procedure pretty quickly and then close up the area, there's less of a chance for infection, there's a better chance of healing more quickly. So the studies show the quicker that we're able to do and safely do the procedure, the better off the patients are going to be afterwards. So that's where our experience comes into play. I think the main thing is that we connect with our patients, and so as soon as they come in, we're under the assumption that they're going to be nervous. We can see it on their face many times, and so I think establishing a connection outside of their teeth, say, yes, I know you're here for wisdom teeth. I'm going to let you know this isn't going to be as bad as you think it's going to be. And one of the reasons, or one of the ways that we do that is to say, hey, listen, give me 20 or 30 minutes of your time. You're going to be asleep, you're going to be numb, you're going to be comfortable. And one of the things that does is it lets them know, hey, this isn't an hour. I hear about it all the time. Well, does this take an hour or 2 hours, or how long will I be there? And it's like, you won't be there that long. And then we start to connect with a lot of the students. I was a student here as well. So I kind of know what they're going through. I know what life is like in Ann Arbor, and do everything we can to kind of work around their school and that type of thing. And so after we go through all of those things and we start talking about football or basketball or whatever else that they're into, especially in this area, it really helps to calm patients down and to really distract them from, hey, yes, I'm having the wisdom teeth out, but at the same time I know, he said, it's not only going to be about a half an hour, and it's not going to be that bad. And from a post-op recovery standpoint, we have some medications that are going to help, and we're on call all the time. So there's a doctor on call 24 hours a day, 7 days a week, every day of the year. So if they need something, we're always available to them. I think that it's important to have an oral surgeon versus a general dentist who is removing wisdom teeth because of the possible complications that can occur. So in order to take out impacted teeth, which means it's covered under gum tissue and in bone, we have to make a little cut in the gums. We're going to have to drill away some bone, and we're going to have to divide the tooth and remove it. And sometimes the tooth and nerve are very close to one another, so that's important to know with the anatomy and having the experience to say, hey, I need to do something a little bit differently here. And if I encounter some bleeding in there, we have experience in surgery, which will help us encounter and tackle any of the complications or potential difficulties that we have during the procedure. So I think it's a matter of experience. I've had an additional 7 years of residency outside of dental school, and so during that period of time, and of course the 19 years afterwards that we've been training and working here in private practices, lended itself to a wealth of experience that, like general dentists will have the ability to do a crown, and I'll joke with my patients. They'll say, why can't you do the crown on my implant? And I'll say, because you don't want me doing the crown on your implant. I'll leave that to the experts. Leave that to the general dentists and the prosthodontists who do this every day, and this is something that we do every day, and I think that's the benefit of going to an oral surgeon. I think a common misconception about wisdom tooth recovery is that it's going to be a very difficult and arduous period of time. I'll hear some patients say, well, I need to take a week off, or I can't exercise after until a week or two later. And I think that they think that the recovery time is a lot longer and more difficult than it really has to be. I think that swelling can peak 2 to 3 days later, but The earlier patients come in, so for example, a patient comes in and they're 15 years old versus a patient who comes in and they're 30 years old, there's a big difference in the time to recover. It's going to take a lot longer for a 30-year-old to kind of get over that hump versus a younger patient. So in as much as we can see younger patients, we can ensure that, okay, after a couple of days, things are going to kind of swell and peak, but we're going to provide pain medications to you, we're going to provide anti-swelling methods to you, and really it's not going to be as difficult or as arduous as you can. And you can kind of get back to normal life after 3 to 5 days. You can kind of get over that hump and get back to sports and life and in school and all those other types of things that they may be involved with. I think one of the main things when someone reports that their friend had a bad experience with wisdom teeth is that everybody's different, and we really need to look at the case. What did those teeth look like? How was the patient presenting? Were they infected? Were they in pain before they started? Because those are going to be factors that are going to lead to more difficult extractions and perhaps more complications and difficulties as they're recovering. So all cases are different, and by the same token, if somebody has a great experience, well, we have to look at that patient as well and say, well, my patient, my friend had a great experience, but here I am, I'm very sore, I'm very swollen, I'm older than my friend was, etc. And so a lot of those factors are considering the patient's individuality. And so what we do is we look at, again, go back to our experience of, hey, this is what we see, and this is how we try to mitigate some of the pain and some of the risk that we can see. And so that's a great reason, again, to go to an oral surgeon with experience who does this. And I think that we really can individualize our cases, and so that patients can say, well, even though my friend had a bad experience, I'm different because of this, that, and these are the things that we're going to do in order to ensure I have a good experience, or at least the best experience I can. And if I have issues, I know that they're going to be there to back me up when I call.